China is on the brink of a pandemic explosion, or maybe it has already exploded. The world would know better if China would exchange information freely, but then that's not China's style. China's handling of the pandemic since 2020 is a testament to its style. Harsh, non-negotiable stance with unwavering execution of decisions of the government is what led to the Chinese population rise up against the severe COVID-19 restrictions under the zero COVID policy. And then came a knee-jerk reaction from China. Sudden dismantling of its strict zero COVID regime of lockdowns and mass testing. This led to a surge of cases that exposed the system of health, which was completely unaware. This led to a surge of cases that exposed the health system to be completely unprepared. Experts predict that the country of 1.4 billion people could face more than 1 million COVID-19 deaths next year. And what is the response of a regime that kept people under lock and key for almost 3 years in the name of COVID? Too simplistic. China says tracking COVID cases is now impossible as infections soar. Hello and welcome to 360 Degree, where we do a deep dive into the issue at hand. I'm Anjilee Istwal. Let's try and understand how a country and its response that was once hailed as unique and unprecedented public health response that apparently reversed the escalating cases. And this was said by the World Health Organization, or the WHO, in February 2020, is now turning into a COVID nightmare for the whole world. To do this, we turn back the clock to December 2019. On December 31st, 2019, China informed the World Health Organization about cases of pneumonia of unknown origin detected in Wuhan city in China. The world later knew it as coronavirus. As the virus spread across the world, China clamped down on everything: information, freedom, and subsequently vaccinations. In mid-January, Chinese authorities introduced unprecedented measures to contain the virus, stopping movement in and out of Wuhan and 15 other cities in Hubei province, home to more than 60 million people. Flights and trains were suspended and roads were blocked. Soon after, people in many Chinese cities were told to stay at home and venture out only to get food or medical help. Some 760 million people, roughly half the country's population, were affected. By February, the world was taking notice of China's response and calling it effective, as the graph in China remained low. By March, that is 2 months after the lockdown began, the number of new cases was around a couple of dozen per day, down from thousands per day at the peak. But behind all this efficient response, there lurked a dark truth. China was merely suppressing the virus, not eradicating it. Moreover, China wasn't utilizing the zero COVID policy judiciously. It was busy in vaccination nationalism and stonewalling Western vaccine. There was another dark truth behind this China response that even West was appreciating. This zero COVID was achieved through draconian measures. Families were broken up and separated after testing positive. Even children were taken away from parents to be placed in isolation. Even asymptomatic cases were taken away for extended periods of separation and isolation. Government's heavy-handedness was creating discontent, and the country continued with these severe measures till people spilled onto the streets, resulting in riots and protests. But this happened after almost 2 years. All this while, China's graph remained low. There were some bumps with the deadly Delta and then highly infectious Omicron, but nothing that could match the mayhem in the rest of the world. Irrespective of low reported death rate, the frustration was smoldering beneath the surface. The frustration was with the economy as well. While there was a sharp recovery in economy after the first wave of 2020, the economy started dipping due to the stringent COVID restrictions. One thing was clear: corona fatigue had set in. And then came the onslaught of Omicron early this year. The vaccine hesitancy of the elderly left them vulnerable to this highly transmissible variant. The vaccine nationalism had ensured that Chinese citizens didn't have access to the vaccines being used internationally. with the world still in dark over the true efficacy of Chinese vaccination drive also came under a cloud of doubt. Finally, early this week, China approved 4 new COVID-19 vaccines for emergency use. There are now a total of 12 COVID-19 vaccines available in India, but the distrust towards the earlier indigenous vaccines has ensured low third dose distribution. Also, none of these 9 domestic vaccines have been updated for Omicron and subsequent subvariants. The strict COVID measures imposed on Chinese citizens were painful, but they stopped the virus in its tracks for 3 years. However, because a large portion of the population had never been infected by the virus, they lacked natural immunity, leaving them extremely vulnerable. As a result, when the virus breached the defenses, it spread rapidly. And now, with low natural immunity, low vaccination rates, and a callous government, the people are completely defenseless against the virus. So what is China's solution? Simple, just lie. The National Health Commission of China has announced that only deaths caused by pneumonia and respiratory failure in patients who had the virus are classified as COVID-19 deaths. This basically means deaths due to any underlying diseases aggravated by the COVID-19 infection will not be counted. It's well known that China has been misreporting the statistics of the pandemic from the beginning. Look at these stats from different sources. How different they are. Johns Hopkins Coronavirus Resource Center says that till date, as of 22nd December, total confirmed cases in China have been 43,13,712 and total number of deaths from the beginning of the pandemic is 16,589. As of 28th November 2022, a total of 346,51,13,661 vaccine doses have been given, with more than 92% of population receiving at least 1 dose. The numbers for cases and deaths are different on the WHO dashboard. Confirmed cases since the pandemic started are 1,01,12,335, whereas deaths on the WHO dashboard are 31,431. So the point to note in both the statistics is the huge difference in deaths, since Johns Hopkins is using the official Chinese data. But look at these graphs. Do they look like any COVID-stricken country in the globe? China has been reporting 0 COVID deaths most of the days now. It seems to have switched to 0 death reporting policy from 0 COVID policy. Do tell us what you think about this video in the comment section, and for more news updates, subscribe to India Today.